Thank you so much for joining us. And joining me today is Dr. Daniel Cheros to talk about a specific in-office procedure for sinusitis patients. But first, when patients hear in-office, I think they kind of nod, but what exactly are you talking about?
So literally, we're performing a procedure to help them breathe better and clear up the sinus infections in our office, in our procedure room in the office.
Mm-hmm. You don't have to go to any operating room, nothing like that.
That's correct. If we did, that would be in the operating room. This is in the office. Mm-hmm. And so what it means is it's done how patients come into the office. They walk in, the procedure is done in the procedure room, they're awake. We spend a lot of time getting them very numb, very comfortable for the procedure. Maybe they'll take a little Valium pill beforehand to take the edge off. But you know, the idea of doing procedures in the office is kind of common to everybody. You've been to the dentist.
Of course.
We've all had our teeth cleaned or our gums worked on or what have you. And you know, there's an idea that you feel a pinch and a burn with some of the local anesthetic, and you know, someone's kind of up close and personal working away in your mouth, but you never really thought to yourself, boy, I'm going to go to the operating room to get my teeth cleaned. And it's kind of like that. So we're doing a procedure, only this time in the nose, and we've got scopes and instruments going in and out, and you might feel a little bit here or there, but for the most part, the patients are very, very comfortable, and they're having an experience that's going to enable them to literally walk out of the office the same way they walked in.
And another benefit to an in-office procedure like this would be to kind of get to sinusitis before it gets to be severe. Is that correct?
Well, that's what the data coming out is starting to show. You know, the idea that we can intervene in the office probably a little bit earlier in the process, because those patients may not even qualify for surgery in the first place. We can basically get to the patient before a little problem starts to set up shop and becomes a bigger problem.
And those would have to be under anesthesia
potentially,
in an
exactly.
Good. What are the outcomes of the in-office procedure?
We've seen fantastic outcomes. And you know, on some level, the patients who find that they are candidates and get done in the office, they're really some of our happiest patients, because they've had the benefit largely of what would have been a surgical procedure, but they're able to do it in the office, awake, go home, have maybe a couple days of some congestion, oozing, recovery time, little tenderness, but by the end of that, their problem's fixed.
Great. Dr. Cheros, great stuff. Thank you so much.
Nice talking with you.
And we'll see you next time.